STEMI management is a priority in patient care, and the 12-lead ECG is necessary for diagnosis. To obtain an accurate 12-lead ECG, proper electrode placement is crucial. Let's go over how to do that. With practice, you'll get very quick at it. Just like ECG monitoring, we have the limb leads. But for acquiring a 12-lead ECG, we need to put the limb leads out here on the limbs. You can put the electrodes anywhere along the limbs, just not on the torso. Okay, we have the limb leads on. Let's do the precordial leads. Now, we're going to position these leads around the patient's heart, here. We recommend finding the right spots like this. Start with your finger at the notch in the top of the sternum. Move it down until you feel a little elevation. That's the angle of Louis, where the manubrium joins the body of the sternum. Move your finger to the patient's right a little and drop it into the second intercostal space. Down a little to the third intercostal and one more to the fourth intercostal space. Put the first electrode right there. From the first electrode, run your finger across the sternum to the fourth intercostal space on the patient's left. Place the second electrode right there. Next, we're going to skip over the third electrode and place the fourth. Move down to the fifth intercostal and then to the mid-clavicular line, right there. Place the fourth electrode. Now go back and put the third electrode halfway between the second and fourth electrodes. There. Good. The fifth and sixth electrodes are both at the same level as the fourth. Put the fifth on the anterior axillary line. And put the sixth on the mid-axillary line. Good. Now, before we acquire a 12-lead ECG, let me make a couple of other points about electrode placement. With a female patient, you might need to place the third, fourth, fifth, and sixth leads underneath the breast rather than on the breast. You can see how the placements are adapted in this particular case. And never use the nipple as a reference for lead placements on either men or women. Nipple locations just vary too much from patient to patient. Okay, all the electrodes are on. Connect the precordial lead attachment to the ECG cable like this. Ask the patient to lie still and push this button to acquire a 12-lead. This is the first 12-lead ECG for this patient, so the age menu appears. Use the speed dial to enter the patient's age and sex. Both are important for the analysis algorithm to provide correct interpretive statements. If you don't enter anything, the defaults of 50 and male are used for the interpretation. It will take a few seconds to acquire the data. It acquires a 12-lead ECG, analyzes, stores it, then prints it out automatically with lots of useful information. Here's the printout. This is an example of a 3-channel standard format. Other formats are available. Notice the word unconfirmed at the top of the report. This means that the algorithm's interpretive statements should only be used to prescribe or withhold treatment when the ECG waveform data has been confirmed by qualified medical personnel. There's a feature of the Lifepak 15 you should know about called ST trending. It can be very useful in STEMI management. Be sure to watch the section on vital sign and ST segment trends and read about it in the operating instructions. Okay, now one thing that can go sideways is when you press 12 lead, you might get this message. Noisy data. Press 12 lead to accept. The noise is usually patient or electrode related. So here are some preventive things you can do to avoid common sources of ECG noise in the first place. Use fresh electrodes from sealed packages. Develop the habit of a brisk skin prep. Make sure the patient is warm and comfortable with arms and legs supported. That goes a long way to reduce noise from muscle tension. Try to wait at least 30 seconds after applying the electrodes before you press 12 lead. Electrodes need a little time to stabilize. Secure the lead wires and the cable to eliminate any tugging on the electrodes. When the noise is eliminated, the 15 automatically completes the 12 lead report. If you've done everything you can but the noise still persists, look for electronic interference from radios or other electronic equipment. And, like the message says, you can press 12 lead again despite the noise. The 12 lead ECG will be printed, but without the interpretive statements. If you have to defibrillate, be sure to remove all the electrodes that could interfere with therapy electrode placement.